ഹലോ ഫ്രണ്ട്സ്, വെൽക്കം ബാക്ക് ടു മൈ യൂട്യൂബ് ചാനൽ. നമ്മുടെ 30/1/2021 നടക്കാനിരിക്കുന്ന കേരള PSC സ്റ്റാഫ് നഴ്സ് ഗ്രേഡ് 2 എക്സാമിൻ്റെ സിലബസ് പബ്ലിഷ് ചെയ്തിട്ടുണ്ട്. അപ്പോൾ നമുക്ക് സ്പീഡിലൊന്നത് നോക്കി പോവാം. ഫസ്റ്റ് മൊഡ്യൂൾ 1 ബിഹേവിയറൽ സയൻസിൽ അനാട്ടമി ആൻഡ് ഫിസിയോളജി, അനാട്ടമിക്കൽ ടേംസ്, സർക്കുലേറ്ററി സിസ്റ്റം, സ്ട്രക്ചേഴ്സ് ആൻഡ് ഫങ്ഷൻസ് ഓഫ് ഹാർട്ട് ആൻഡ് ബ്ലഡ് വെസൽസ്, ലിംഫാറ്റിക് സിസ്റ്റം, സ്ട്രക്ചേഴ്സ് ആൻഡ് ഫങ്ഷൻ ഓഫ് lymph vessels, lymph circulation and lymphatic tissues, spleen and thymus, respiratory system, structures and functions of respiratory organs and characteristics of normal respiration and deviation. Next, digestive system, structures and function of alimentary tract, excretory system, structure and function of kidney, formation and composition of urine, fluid and electrolyte balance, endocrine system, structure and function of thyroid, parathyroid, pituitary, adrenal gland and pancreas. And continuation of anatomy and physiology, reproductive system, structure and function of male and female reproductive system, structure and function of breast and reproductive health. Nervous system, structure and function of brain, cranial nerves, spinal cord, motor and sensory pathways of spinal cord and autonomic nervous system. Next, sense organs, skin, eye, ear, nose, tongue, physiology of vision, hearing, smell, touch, taste and equilibrium. Next, skeletal and muscular system, formation and growth of bone, tendon, ligament and cartilage, calcification of bone, axial and appendicular skeleton, structure and function of muscle. Next is microbiology, history of bacteriology and microbiology, types of microorganism, normal flora of body, pathogenesis and common diseases, culture and isolation of microbes, sources and types of infection, factors affecting growth of microbes, cycle of transmission of infection, reaction of body to infection, mechanism of resistance and collection of specimen. Society, including definition, social groups, type structure, intergroups relationship, group cycle, group behavior and group morale, social change, factors affecting and effect on society and institution leading to social problems, social control, social stratification, social problems, prostitution, crime, divorce, dowry system, juvenile delinquency, drug addiction, alcoholism, handicapped, overpopulation and slums, social agencies and remedial measures, culture and characteristics of community, definition, rural and urban, cultural and characteristics. Next, module 2 behavioral science. First one is psychology, concept, scope and significance of psychology for nurses, structure of mind, conscious, preconscious, ego and superego, psychology of human behavior, concept of mental health, basic human needs, dynamic behavior, motivation of drives, body mind relationship, mental health, and mental mechanism, uses and importance, attitudes, meaning, development, changes in attitude, effects of attitude on behavior, importance of positive attitude for nurses, habit, meaning and formation, breaking of bad habits, importance of good habits formation for nurses. Next is learning, nature, type, law of learning, factors affecting learning, memory and forgetting. Next is thinking and reasoning, nature and type of thinking, reasoning, problem solving, importance of creative thinking for nurse. Continuation of that, observation and perception, attention, perception, loss of perception, factors affecting attention and perception, errors in perception, concept and development of personality, assessment of personality, characteristics of various age groups, will and character, nature and measurement of intelligence, mental ability, nature of intelligence and development, individual difference in intelligence. Next is sociology, nature, scope and significance of sociology in nursing, socialization process, influence of environment on individual development, rights and responsibilities of individual in society, socialization process, effect of environment on human growth and development, concept, characteristics and types of family, family cycle and basic needs of family, functions of family, importance of independence of family members, importance functions of family and their problems, type of marriage, medical and sociology aspect of marriage. Next is Module 3, Fundamentals of Nursing, Concept, Scope, Ethics and Principle of Nursing, History of Nursing in India, Healthcare Agencies, Holistic Approach in Nursing, Determinants of Health, Effect of Illness, Therapeutic Environment, including physical, psychological and aesthetic factors, Prevention of Environmental Hazards, Patient's Adjustment to Hospital person, Socioeconomic and Cultural Background, Admission, Transfer and Discharge Procedures, Basic Nursing Skills including Communication, Interview, Recording and Reporting, Nursing Process including Assessment, Diagnosis, Planning, Implementation and Evaluation, Meeting the Basic Needs of Patient including Physical Needs, Hygienic Needs, Elimination Needs, Nutritional Needs, Psychological Needs, Spiritual Needs, Diversional and Recreational Therapy, Care of Terminally Ill and Dying Patient, Assessment of Patient, Physical, Psychological and Psychosocial Assessment. Next, continuation of that, infection control methods, nature and type of infection, chain of infection transmission, medical and surgical assets including isolation precaution, barrier nursing, hand washing, isolation, personal protective equipments, its uses, types, technique of wearing and removing, transportation of infected patient, biomedical waste management including importance, types, hazards, decontamination of hospital waste, segregation and transportation and disposal. Next, therapeutic nursing care including care of patient with respiratory problems, altered body temperature, fluid electrolyte balance, body elimination deviation, care of unconscious patient, bedridden patient and care of patient with pain, clinical pharmacology including principles, route of effect and storage of medications, medication errors, broad classification of drugs, system of drug measurements, dosage calculations, terminologies and abbreviations used in the prescription of medication, oral and parenteral therapies, advanced technique, epidural, intrathecal, intraosseous, intraperitoneal, intrapleural, intraarterial, topical administration, direct application, inhalation, recording and reporting of medications administered. Next is first aid. Importance and principle of first aid, procedure and technique in first aid, transportation of injured, CPR, first aid in emergencies including asphyxia, drowning, shock, wounds and bleeding, injuries to the bones, joints and muscles, fractures, sprains, strains, hanging, falls. Next, burns and scars, poisoning, ingestion, inhalation, bites and stings, foreign body in ear, eye, nose and throat, various community emergencies and community resources like fire explosion, flood, earthquakes and role of nurse in disaster management and rehabilitation, community resources like police, ambulance services, voluntary agencies, local, state, national and international. Next is Module 4, Community Health Nursing, Concept of Health and Disease, Primary Health Care, Promotion and Maintenance of Health, Philosophy, Goals, Objectives, Principles, Concept and Importance of Community Health Nursing, Qualities and Functions of Community Health Nurse, Steps of Nursing Process, Health System in India, Healthcare Delivery System, Health in India, National Health and Family Welfare Programs, Major Health Problems in India, Specialized Community Health Service and Nurses' Role, Concept and Function of Health Team, Role of Nursing Personnel at various levels, Health Information System, Health Agencies, International and National. Next, continuation of that. Health assessment of infant, preschooler, school-going, adolescent, adult, antenatal, postnatal women and elderly, principle and use of epidemiology, levels of prevention of disease, disease transmission, immunization, control of infectious disease, family health services, family health goals, purpose and principle of home visit, bag technique and referral system, records and reports, types and its uses, preparation and maintenance, management of minor ailments. Next is nutrition, classification of foods, normal dietary requirements, balanced diet, disease and disorders caused by imbalance of nutrients, food intolerance, inborn errors of metabolism, various methods of food preparations, preservation and storage, therapeutic diet, diet modification in relation to medical and surgical conditions, special diet, low sodium, low fat, iron rich, low protein, high calorie, geriatric diet, diabetic diet, bland diet, high fiber diet, liquid diet, semi-solid and soft diet, nutritional programs and problems in India. Next is Module 5 Medical Surgical Nursing, that including pathophysiological mechanism of disease, altered immune response, autoimmune disease, fluid electrolyte balance, operation room technique, management of patient undergoing surgery, including preoperative, intraoperative and postoperative, management of patient with impaired respiratory function, GI disorders, metabolism and endocrine disorders, renal and urinary disorders, neurological disorders and connective tissue and collagen disorders, nursing management of elderly, preventive and screening and early detection warning signs of cancer, epidemiology, etiology, classification, pathophysiology, staging, clinical features, diagnosis, treatment modalities of oncological conditions, oncological emergencies, treatment modalities, immunotherapy, radiotherapy, surgical intervention, stem cell therapy, bone marrow transplantation, gene therapy and other forms of therapy. Continuation of that. Psychological aspect of cancer, rehabilitation, palliative care, drugs used in cancer, medical and surgical and nursing management of patient with burns, breast disorders, integumentary disorders, plastic and reconstructive surgery, skin graft, flap, complication, preparations of patient for constructive surgery, postoperative care and health education, management of patient with ophthalmic conditions, preventive and rehabilitation aspect of national programs on blindness, ocular emergencies, eye banking, eye irrigations, eye dressing and bandage, assisting for removal of foreign body, management of patient with ear, nose, throat disorders, cardiovascular, circulatory and hematological disorders and communicable disease, management of patient with sexually transmitted diseases and musculoskeletal disorders, role of nurse in medical and surgical emergencies, scope and practice of emergency nursing, principle of emergency care, triage, airway obstruction, hemorrhage and shock, trauma, intra-abdominal crush injuries, multiple injuries and fractures. Continuation of that, poisoning, ingested inhaled food poisoning, injected poisons, stinging, snake bite, chemical burns, environmental emergencies, heat stroke, snake bite, drowning, hanging, role of nursing emergency and disaster nursing, natural and man-made emergency preparedness, community resources. Module 6 including mental health nursing, concept of mental health and mental illness, principle of mental health nursing, history and trends of psychiatric nursing, national mental health program, mental health assessment, history taking, MSc, interview technique, national mental health programs, therapeutic nurse-patient relationship, common and phases, significance, communication skills, factors influencing communication and barriers. Next, continuation of mental health nursing, including pathophysiology of human behavior, classification of mental disorders, disorders of thought, motor activity, perception, mood, speech, memory, concentration and judgment, management of patient with various mental disorders, personality, types of personality related to psychiatric disorder, substance use, child and adolescent psychiatric disorders, sleep, eating and sexual disorders, biopsychosocial therapies and role of nursing these therapies, concept of preventive mental health services during childhood, adulthood, old age and role of nurse in national mental health services, psychiatric emergencies and crisis intervention, patient with overactive, underactive and violent behavior, suicide, adverse drug reactions, withdrawal symptoms, acute psychosis and forensic, psychiatric and legal aspect. Next is Module 7, that including child health nursing, concept of child health care, trends and emerging challenges for pediatric nurse, preventive, pediatric and vital statistics, growth and development, role of nurse in caring sick child, pediatric procedures, medical and nursing management of children with behavioral disorders, management of children with communicable disease, child abuse, protein allergy malnutrition, bites, stings, pica, ticks, Health problems of children, accidents, obesity, juvenile delinquency, nursing management of patient with congenital disorders, management of patient with various disorders of renal system, respiratory system, GI system, cardiovascular system, hematological system, neurological system and endocrine system. Continuation of that. Management of handicapped children, mental retardation, dyslexia, vision and hearing impairment, fluid electrolyte imbalance, burns, problems of locomotion, osteomyelitis, poliomyelitis, kyphosis, lordosis, scoliosis and fracture, pre and post-operative care of children undergoing surgery, various child welfare services, ethical and legal aspect of pediatric nursing. Next is Module 8, Midwifery and Gynecological Nursing, Scope and Trend in Midwifery, Vital Statistics related to maternal health in India, Stages of embryological and fetal development. Continuation of that. Stages, normal pregnancy and its management, preconception care, genetic counseling, psychological changes in pregnancy, diagnosis of pregnancy, antenatal care and minor disorders of pregnancy, various stages of labor, role of midwife in caring for a woman in labor, management of normal newborn, management of normal puerperium, management of complications during pregnancy and pregnancy, management of high-risk labor and complications of third stage, puerperal complications and its management. And continuation of that, assessment and management of high-risk sick newborn, levels of care of in neonate ICU, obstetric emergencies, post-abortion care, role of midwife in the administration of drug during pregnancy, labor and postpartum period, drugs used in obstetric and teratogens, ethical and legal issues related to midwifery, terms used in gynecology, history taking, examination and interventions in gynecology, physiology, psychology and pathology of puberty, fertility and infertility, management of patient with various pelvic infections, care of women with gynecological disorders, management of patient with breast disorders, menopause, physiological changes, signs and symptoms, health education, counseling, hormone replacement therapy and surgical menopause. Next is Module 9, Nursing Education and Introduction to Research, Concept of Education, Teaching Learning Process, Method of Teaching, Significance of Research in Nursing Research Process, Purpose, Objectives and Steps of Research Approach and Design, Types, Methods, Advantages and Disadvantages, Data Collection Process including Method and Instruments of Data Collection, Data Analysis, Complications, Tabulation, Classification, Summarization, Presentation and Interpretation of Data using Descriptive Statistics, Introduction to Statistics, Scales of Measurement, Frequency Distribution, Mean, Median, Mode and Standard Deviation, Utilization of Research in Nursing Practice. Next is Module 10, Professional Trends and Adjustment and Nursing Administration and Ward Management, that including nursing as a profession, role of a professional nurse, professional ethics for employment, personal and professional development, career nursing, continuing education and in-service education, legislation in nursing profession and related organization, philosophy and principle of administration, management process, post-scope, policies of hospital and various department of hospital, administration of different healthcare units, legal responsibilities, leadership style, management of supplies and equipments, cost and financing of healthcare services in India, national health plans, role of state and central government in allocating the fund and health insurance. അപ്പോൾ ഇത്രയാണ് സിലബസിൽ ഉൾപ്പെട്ടിട്ടുള്ളത്. നമ്മൾ നഴ്സിങ്ങിന് പഠിച്ച സിലബസിലെ എല്ലാ കാര്യങ്ങളും നമ്മുടെ PSC എക്സാമിന് വരുന്നുണ്ട്. ഈച്ച് ആൻഡ് എവരി പോയിന്റ് ഇൻക്ലൂഡ് ചെയ്യുന്നുണ്ട്. അപ്പോൾ സ്റ്റഡി വെൽ, stay safe. Thank you for watching. Please subscribe my channel for more videos.